Hi, I'm Candace Concy, and welcome to Roycan Natural Health Care Center. Today we're going to be talking about craniosacral therapy. In 1985, a Dr. John Upledger started an institution down in Florida where he started teaching craniosacral therapy, and he was instrumental in developing this program. It's a really amazing program. We've had some unbelievable results with it. So I'm just going to kind of go through what it's entailed, and then we've got some testimonies, and we're going to be doing an actual treatment to be able to show you what it's all about. So in very simple forms, and I mean there's a lot to craniosacral, there is an actual dural tube that totally surrounds your spinal cord, goes from your tailbone and right up and totally surrounds your skull. If I was to open up your back, there would actually be a vibration, there'd be a movement from that dural tube, and I would actually be able to see it. Now, with craniosacral, I can actually feel that rhythm. And if, as we all know, everything kind of flows into the spinal cord, so your lymphatic system, central nervous system, your organs, everything goes into your spinal cord. So when people get sick or their bodies just aren't functioning properly, that dural tube that surrounds the spinal cord, which is your craniosacral, actually can be compressed, and the rhythm can be off. It can show where it's vibrating too much or there's a blockage. So with the light pressure of just my fingers, and light pressure would be 5 grams, which would be no more than the weight of a nickel. So with that light pressure, I find where the blockage is and release it. So if someone comes to me with a lot of pain, then finding where that blockage is, I can release it with craniosacral. Now, of course, there's a lot more to it, and we're going to be able to show you that with some of the treatments that we will video. Craniosacral, we've been really fortunate that we've had the experience of working with newborns. If you think about it, newborns are inside their mom for a long time. So to be able to get your hands on them and do a craniosacral and release that dural tube prevents a lot of colic when it comes to babies. I also work with the skull, and there's suture lines in the skull, and there's actually fascia in between those suture lines, and that can get jammed up. So there again, with the light touch, we're able to just release that pressure in order for people to not have migraine headaches. A lot of times I will work with concussion patients, which will help them in the healing process, brain injuries, anything really that your body can suffer from, craniosacral can help. So we're going to put together these tapes in order for you to understand a little bit more and sort of see what we do. Plus we've had some amazing testimonies from various clients that are willing to come in and talk about their treatments. So stay tuned, and we will upload as soon as we can the various testimonies and treatments with craniosacral therapy.